Health Canada has authorized Pfizer's bivalent vaccine for kids 5 to 11. The decision came after a thorough and independent scientific review indicating that the Omicron targeting booster is safe and effective for children. Health Canada says the dose for children is 1/3 of that authorized for individuals 12 years of age and older. Here to talk about this on the bivalent vaccine by Pfizer for kids, we're now joined by Dr. Dina Kulik, a pediatrician and emergency medicine physician. Dr. Kulik, thank you so much for joining us.
You're welcome.
Particularly on this weekend. So I want to talk to you about this bivalent booster. So the National Advisory Committee on Immunization strongly recommends the bivalent booster for children with, it says, underlying medical conditions and weakened immune systems. But the recommendation for other children in that age group is more discretionary, and NACI suggests the bivalent booster may be offered. So for parents who don't have kids with weakened immune systems or who are challenged by a medical condition, how do they decide?
I think it's a worthwhile conversation with someone's healthcare provider to review their child and their child's health history. But regardless of whether the child has true, if they're a rather immunocompromised or vulnerable person, we know that the uptake rate for boosters has been quite low. Many kids receive their primary series, their first and second dose of COVID vaccines many months ago. A lot of kids had them, 8, 9, 10 months ago. And we know that the immunity will wane over time from these initial vaccines. So it is definitely worthwhile considering getting your child a booster, and particularly one of these boosters which cover for BA4 and BA5, which are very predominant strains right now. If you want your child protected, even if they've had previous infection, even if they've had the previous 2 boosters, it is definitely worthwhile considering getting these vaccines for your kids.
Okay, thank you, Dr. Dina. And on the topic of RSV, I've been here for years and we've never, that I recall, have talked about RSV, and suddenly we're talking about it all the time. I understand that, suddenly if everyone's hearing so much about this, it's because the virus came earlier and hit harder this year than in years past, and that's the case in the U.S. and here in Canada. Are you finding that the situation is improving?
I wish I could say that it was improving, but I don't think that's the case. RSV is ubiquitous. About 98% of children will get RSV before they are 2 years of age. It's one of the most common viruses kids get. However, this year, as you mentioned, it hit hard and very early. And because there's also a lot of circulating influenza as well as COVID, many kids are getting 2 or even 3 viruses at a time. And because of the sheer number of children that have RSV and these other illnesses right now, unfortunately, clinics and hospitals are inundated with sick patients. And unfortunately, some kids are getting very sick with these illnesses.
And I know this has been discussed throughout the last month or so here on our channel, but what do you say to parents? What can they do?
I think avoiding people that are sick is a really easy one. Easier said than done when we're getting together for holidays and other gatherings. But when we can, keep our distance from people that are sick, wear a mask if you're indoors with others. If you're older than 2, I very strongly encourage people to wear masks at school, in workplaces, outside with other people. And of course, wash your hands, and please consider getting the flu shot and the COVID vaccine, because these vaccines will help prevent the spread of these illnesses. But please, biggest thing is stay home if you're sick. If you're going to school, you're going to workplaces, you're going to parties, you're going to restaurants, and you're unmasked and you are sick, you are quite likely to spread the illness you have to other people. Some of these people may get very sick with these illnesses, and this will lead to an increased burden of these viruses in our communities.
And does the bivalent booster help with RSV in any way?
No, the bivalent booster for COVID is for COVID alone. It would not be protective against RSV or influenza.
Okay, that's what I thought. Thank you for clarifying. One other question here, Dr. Kulik. So a story we shared just before you joined us, that the South Bruce Gray Health Centre is reviewing its COVID-19 policy, considering bringing back to work unvaccinated nurses to deal with staffing shortages. And this comes as hospitals across the province and country not only deal with a surge of these illnesses, but most health networks dropped their vaccine policy already. Is this a good idea? I mean, if there's a shortage of nurses, there's nurses willing and able to work, but they're not vaccinated. Should they be brought back to work? What do you
It's a
think?
great question. We certainly have these humongous shortages for healthcare providers, nurses, doctors, phlebotomists, porters, all sorts of people in the hospitals. When someone is sick, they should stay home. If you are providing patient care, you should be masked. Ideally, everyone is vaccinated against COVID and influenza and every other thing we can vaccinate against. But at the very minimum, people should absolutely be staying home if they're sick and wearing a mask while providing any care within hospitals and clinics.